Hello, my name is Rebecca Hajos. I'm a registered nurse and a student at Viterbo University. I chose a topic regarding fall prevention in nursing related to polypharmacy. A little bit of background on this topic. Falls are a leading cause of injury among older adults in healthcare settings, with polypharmacy identified as a significant contributing factor due to medication side effects and interactions. Evidence suggests that multidisciplinary medication review programs can actually optimize pharmacotherapy, reducing risks associated with polypharmacy while improving patient safety. Implementing such interventions within nursing practice could play a critical role in decreasing fall rates and enhancing outcomes for hospitalized older adults. This led me to pose the PICO question. In older adults hospitalized in acute care settings, how does implementing a multidisciplinary medication review program compared to standing nursing care without a focus on polypharmacy management affect the rate of patient falls? In review, I chose 5 separate articles. The methods I chose to use to determine which articles to identify for this project were using databases such as the Viterbo library. I just felt like it's the most easy to use. I can really easily filter through the search terms and inclusion criteria. And those search terms that I used were fall prevention, nursing, and polypharmacy. The inclusion criteria I used were locating articles that were written within the last 5 years, opting for articles over textbooks, and then also making sure they were available in English and peer-reviewed. So the first article I chose was Preventing Falls in the Surgical Setting by Implementing a Fall Prevention Bundle. This was a level 3 quasi-experimental study. It talks about implementing a fall prevention bundle that significantly reduced fall rates in surgical settings. For Article 2, it's titled Nursing Care for Hospitalized Older Adults, Fall Accidents versus Safe Mobility, a Scoping Review. This was a Level 5 Scoping Review. It discusses nursing care for older adults and the importance of balancing fall prevention with promoting safe mobility. The third article was titled Nobody Ever Questions Polypharmacy in Care Homes, a Mixed Methods Evaluation of Multidisciplinary Medicine's Optimization Initiative. This was a Level 2 mixed method study. It assesses how multidisciplinary medicine optimization can reduce polypharmacy risks in care homes. The fourth article, titled Development of a Multidisciplinary Medication Management Program in Nursing Homes, Protocol for Randomized Controlled Trial, was a Level 2 randomized controlled trial protocol. It talks about how multidisciplinary medication management programs in nursing homes aim to reduce medication errors and adverse effects. And then last but not least, my fifth article that I reviewed was titled Individual Pharmacotherapy Management, IPM, a group-matched retrospective controlled clinical study on prevention of complicating delirium in the elderly trauma patients and identification of associated factors. This was a Level 3 retrospective controlled study. This study discussed using individualized pharmacotherapy management plans to reduce delirium incidence in elderly trauma patients. So what implications does this have on nursing practice? Well, this potential implementation of fall prevention bundles. So as discussed in that first article I shared, it used structured fall prevention bundles tailored to surgical and perioperative settings. It integrated risk assessments, staff education, and environmental modifications to reduce fall risk. The next implication would be polypharmacy management. A few of these articles talked about optimizing medication regimens with multidisciplinary reviews. And then also collaborating with pharmacists and physicians to de-prescribe unnecessary medications and minimize adverse drug interactions. Another implication would be individualizing patient care plans. So by creating patient-specific pharmacotherapy management plans for high-risk groups, especially the elderly and trauma patients. This can help, and regularly monitoring medication efficacy and side effects to prevent delirium and fall-related injuries. And then last but not least, for implications, safe mobility promotion and environmental safety. We want to encourage safe mobility practices using evidence-based interventions and assistive devices. We want to conduct routine environmental safety audits and address fall hazards like poor lighting and inappropriate bed heights. And we also want to keep in mind that a lot of these patients are on multiple medications that could cause some higher incidence of falls. Otherwise, in conclusion, falls among older adults are a significant concern, with polypharmacy being a key contributor. Evidence highlights the effectiveness of interventions such as structured fall prevention bundles, as mentioned in Kelly et al. 2023, and multidisciplinary medication management programs in reducing fall risks. Tailored nursing care, including safe mobility practices and individualized pharmacotherapy management, further supports patient safety. Nurses play a critical role in these efforts through medication reconciliation, patient education, and collaborative strategies, ultimately improving the outcomes and enhancing quality of life for older adults. All right. If you have any questions, please email me at rhajos84833@viterbo.edu. Thank you so much for your time.